Hey guys, this is Fixer Med. Welcome back to my high-yield anatomy review series for the USMLE Step 1, NBME CBSE, and NBME CAS examinations. In this series, I will be covering a broad overview of the discipline of anatomy across various organ blocks for these examinations. This will be part 40 of my multi-part video series of doing so. Without any further delay, let's go ahead and get started on today's content. Let's start off by taking a look at varicocele. Definition: engorgement of the Pampiniform Plexus leading to a worm-like scrotal mass and enlargement of the spermatic cord. Common side typically forms on the left side. Clinical significance: varicocele on either side may indicate kidney disease, could signal retroperitoneal malignancy obstructing the testicular vein. Let's next take a look at Pampiniform Plexus. Formation: each testicular or ovarian vein forms from the coalescence of a Pampiniform Plexus. Testicular vein forms at the deep inguinal ring. Ovarian vein forms at the margin of the superior aperture of the pelvis. Anatomy: the veins accompany the corresponding arteries. The left Pampiniform Plexus drains into the left renal vein. The right Pampiniform Plexus drains directly into the inferior vena cava, IVC, below the renal vein. Clinical note: varicocele, or the engorgement of the Pampiniform Plexus leading to a scrotal mass, is more commonly found on the left side due to these anatomical differences. Let's next take a look at hemorrhoids, venous drainage from the rectum. Above pectinate line, superior rectal vein drains into the portal system. Below pectinate line, inferior rectal vein drains into the inferior vena cava, IVC. All right, guys, now that we have covered all of the content, let's go ahead and take a look at some questions to review the knowledge you have gained so far. A 22-year-old male presents to the clinic with a complaint of a painless bag of worms feeling in his scrotum, primarily on the left side. He reports that the mass becomes more noticeable when standing and diminishes when lying down. Physical examination reveals a non-tender, irregular mass above the left testicle that increases in size with the Valsalva maneuver. What is the most likely diagnosis? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is C, varicocele. Varicocele is characterized by the dilation of the Pampiniform plexus of veins within the scrotum, which often presents as a painless bag of worms mass that is more prominent when standing and decreases when lying down. The Valsalva maneuver, which increases intra-abdominal pressure, can accentuate this mass. This condition is more common on the left side due to the drainage of the left testicular vein into the left renal vein, which can create higher venous pressure. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A. Testicular torsion typically presents with sudden, severe pain, often accompanied by nausea and vomiting, and the testicle is usually tender, swollen, and positioned higher in the scrotum. This acute condition is a surgical emergency and does not present as a chronic painless mass. B. Hydrocele involves a fluid-filled sac around the testicle, leading to a painless swelling that transilluminates light. Unlike varicocele, the mass is not affected by the patient's position and does not feel like a bag of worms. D. Epididymitis generally causes acute scrotal pain, swelling, and possibly fever, with the epididymis being tender to touch. This condition is often associated with urinary symptoms and is more painful compared to the typically painless varicocele. E. Inguinal hernia may present with a groin bulge that extends into the scrotum, often reducible and associated with a history of heavy lifting or straining. The mass from an inguinal hernia does not feel like a bag of worms and may cause discomfort or pain rather than being painless. All right, now that we have covered this question, let's move on to look at the next question. A 30-year-old male presents to the clinic with a dull, aching pain in his left scrotum that worsens throughout the day. On physical examination, you note a non-tender bag of worms mass above the left testicle that is more prominent when the patient is standing and diminishes when he is lying down? Which anatomical structure is most likely involved in this condition? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The Pampiniform Plexus is a network of veins in the scrotum that drains the testicles. The described condition, where the patient experiences a dull, aching pain with a bag of worms mass that varies with position, is characteristic of a varicocele, which involves the Pampiniform Plexus. Varicoceles are more common on the left side due to the anatomical drainage pattern into the left renal vein, which can lead to increased venous pressure. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A. Cremasteric muscle is involved in raising and lowering the testicle to regulate temperature, but is not related to the venous drainage issues described in varicocele. B. Epididymis is a coiled tube that stores and carries sperm, but does not present as a bag of worms mass. Conditions affecting the epididymis, like epididymitis, typically cause acute pain and tenderness. D. Spermatic cord contains the pampiniform plexus along with other structures like the vas deferens, nerves, and blood vessels, but referring to the spermatic cord does not pinpoint the specific issue with venous engorgement characteristic of a varicocele. E. Vas deferens is the duct that transports sperm from the epididymis to the ejaculatory ducts. It would not present as a bag of worms mass and is not related to the venous drainage problem described in the question. All right, now that we have covered this question, let's move on to look at the next question. A 45-year-old male presents with rectal pain and bleeding during bowel movements. He reports noticing blood on the toilet paper and occasionally in the toilet bowl. On examination, you observe swollen and inflamed veins near the anal opening. Which anatomical distinction best explains the different venous drainage routes for these hemorrhoids? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is B. Above the pectinate line, superior rectal vein into the portal system. Below the pectinate line, inferior rectal vein into the inferior vena cava. Hemorrhoids' venous drainage differs based on their location relative to the pectinate line. Hemorrhoids above the pectinate line, internal hemorrhoids, drain via the superior rectal vein into the portal system, whereas those below the pectinate line, external hemorrhoids, drain via the inferior rectal vein into the inferior vena cava. This anatomical distinction is crucial for understanding the different presentations and potential complications of hemorrhoids. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A. Above the pectinate line, inferior rectal vein into the inferior vena cava. Below the pectinate line, superior rectal vein into the portal system is incorrect because the superior rectal vein, not the inferior rectal vein, drains the area above the pectinate line into the portal system. C. Above the pectinate line, middle rectal vein into the inferior vena cava. Below the pectinate line, superior rectal vein into the portal system is incorrect because the middle rectal vein does not primarily drain the area above the pectinate line. It contributes to the drainage of the rectum but is not the main route for internal hemorrhoids. D. Above the pectinate line, inferior rectal vein into the portal system. Below the pectinate line, superior rectal vein into the inferior vena cava is incorrect because the inferior rectal vein drains below the pectinate line into the inferior vena cava, and the superior rectal vein drains above the pectinate line into the portal system. E. Above the pectinate line, superior rectal vein into the inferior vena cava. Below the pectinate line, inferior rectal vein into the portal system is incorrect, because the superior rectal vein drains into the portal system, not the inferior vena cava, and the inferior rectal vein drains into the inferior vena cava, not the portal system. All right, guys, that is all I have for this video today. If you like this type of content, be sure to leave a like and subscribe for more content like this in the future. Be sure to leave any questions, comments, or concerns down in the comment section below. This is Fixer Med signing off. Be sure to have a great day, everyone, and good luck studying as always. Goodbye.